or there can be bleeding, or there can be a discomfort and a difficulty to maintain the area clean with brush or floss or whatever aids you use.
Now, okay, so we've got these symptoms. We maybe we know something's wrong. We go to the dentist. They confirm that. And what are the different procedures for soft tissue grafting?
Well, there are a variety of different procedures, and I think that we'll discuss those in more details in an upcoming podcast. And that's the good news, because the word gum grafting generally tends to instill some fear or anxiety into patients because they've heard about, the terrible pain that's involved. And the good news is the procedures have really improved so much that a lot of these procedures now can be done with minimal discomfort.
That's great. Now, is there some examples, though, just real quick to tease us for another episode about what kind of procedures we might be confronted with?
Sure. We can take some tissue from the roof of the mouth, which sounds very painful, but with, again, techniques that we'll describe later on, it's not that bad at all. We can make certain incision designs when we're in the area just to roll the tissue from one side onto the other side to create the necessary volume that we need. Or we can even take tissue that doesn't even belong to the patient. It can come from skin, which is from a donor bank, which is completely safe, which we can use. Or it can even come from a different species. It doesn't even have to come from a human. It can come from something even from the animal world that can be used for these type of grafts. And we'll explain that in more detail in another session.
Now, real quick, what are the factors that might determine which course of treatment would be best for the individual patient?
Yeah, that's a really important question. And quite honestly, what we look at is what is the presenting anatomy of the patient? Do they even have, let's say, a good palate from which we can harvest good gum tissue? Or what is the health of the patient? In other words, the less healthy the patient, the more I'm going to choose taking their own tissue so there is no chance of any potential rejection or problems. Or has there been previous treatment in that area with the patient that has led to scar tissue? Scar tissue is very fibrous and has very poor blood supply and leads to compromised healing outcomes. And a really big one is the patient a smoker? For us, that is almost a deal breaker. If the patient smokes, it's not advisable to proceed with the gum graft because it diminishes the blood supply so much, and we depend on that new blood supply for the graft to form. And then sometimes it just comes down to patient preference. Some people say, no, I don't want to take tissue from somewhere else. I want it to be my own. And others say, no, I don't want you to cut my own mouth. Just take it out of a package. And sometimes it can just be how easily can we access the area. It just comes down to the amount that a patient can open their mouth or how easy is it to provide this to perform the surgery. And other times it comes down to what the aesthetic demands of the patients are, because each of these different procedures have different pros and cons in terms of the outcome. And then ultimately, like most things that we're discussing here, it still comes down to the individual clinician's skill and experience.
Now, that's a lot of different factors, and I'm sure that the treatment option is a combination of all of those things in discussion with the doctor, right?
Absolutely. And we spend a lot of time talking about that because we really want the patient to be very comfortable with their choice. And after a discussion and outlining all the different variables, the patients make a decision that they're comfortable with, they proceed with treatment, and they realize after the fact it really wasn't as bad as what they thought it was, and are always very pleased that they went through the procedure because the final outcome makes it worthwhile.
Yeah, for sure. Now, unfortunately, we are out of time, but in the next episode, we are going to go further in depth in our conversation about the techniques available for soft tissue procedures. So make sure you listen to that. And if you know someone who might benefit from what we have talked about here today, please go ahead and share this podcast with them. I'm sure that they'll thank you for it. And of course, you can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And you can always reach his office by telephone at 604-881-1381 or call them toll free at 1-866-931-1981. Dr. Ickert, as always, thank you so much.
Thank you, Nick.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.
This episode is a production of Jam Media. For information on hosting your own web radio show, visit jammedia.com. That's www.jambmedia.com.
The opinions expressed by our guest and host on localwebradio.fm do not necessarily reflect the views of Jam Media or its owners. No expressed or implied opinions of any product or service should be considered an endorsement or recommendation of any kind by Jam Media or its owners.